Thank you, Neil, and good morning, all. I'm very honored to be asked to start off this 2 days of critical conversation. What I'd like to do this morning is to launch us into the important work of this forum by starting with a bit of background, the realities of accreditation, move into some of the challenges that come with accreditation for the profession, the educators, for quality assurance and quality improvement functions of accreditors, and to close with a short list, not so short, of important opportunities that I think this forum is uniquely posed to address. So I'm going to start here. I've got my clicker working, yes. This is a refresher for most of you, but it's a good starting place for today's conversation. There are many right answers to this question, but I'll stick to two of them. First, accreditation refers to a process for external quality review used by higher education to scrutinize colleges, universities, and educational programs for quality assurance and quality improvement. That definition, by the way, comes from the Council of Higher Education Accreditation. Second, accreditation refers to a status. It provides public notification that an institution or program has met the accepted standards of quality, that it's judged to be at an acceptable level or higher by expert professionals in education in that professional field. That's a blend of a couple of sources, including the Association of Specialized and Professional Accreditors. Education, of course, occurs across the globe. As you well know, each country and region does this a bit differently in terms of the source of standards, the evaluation unit, and the focus. In many countries, quality assurance in higher education is based on national or ministerial standards. It's undertaken by a governmental ministry or a national quality agency. In the US, it's a bit different. Accreditation is completely outside of the governmental structure. It's focused on professionally driven standards, carried out in non-governmental associations with peer review undertaken by volunteers. Some systems of accreditation are focused on compliance with standards. I'll call this quality assurance. And some are more focused on quality improvement. Some, like the US, are focused on both compliance and improvement. So going to the realities more, across the globe, what does accreditation actually do? The short answer here is that it confers academic legitimacy on an institution or program in question. A bit longer answer, it advances academic quality, it demonstrates accountability, and it encourages purposeful change and needed improvement. However, there are many expectations of this good seal of approval. For students, for instance, it provides confidence that this is a good program to pursue and that it meets its educational goals. And for some areas of study, most of those represented by this forum, it provides students with the eligibility to access the licensure certification process in their professions. For programs in institutions, it provides accountability, recognition that it's achieving its goals, and that it is indeed providing the quality of education mandated by the profession. It also provides a framework for regular review and schedule. It guides the institution or program to continuous improvement and process and addresses innovation and change. It also protects the institution or program from undue or unwise well-intended guidance from the outside. Any of you who have looked to your accreditation standards to prevent implementation of some well-meaning but misguided ideas about how your profession should work will recognize this function. For the professions, it represents a concurrence within the profession about what academic quality means for that particular profession. It codifies what the profession expects in terms of the preparation of its practitioners, both in terms of process and outcome. And particularly for groups of professions such as those at this forum, it can define the gates for entry into practice. And last, for policymakers and the public, it provides confidence that quality education is being provided, an especially important role when there is public or governmental financial investment in that education. So moving to the challenges, still on realities, what does accreditation not do? While we're thinking about what it does, it's helpful to think also about what it does not do. Well, each of those functions that I just mentioned are reasonable expectations for a quality assurance, quality improvement process. There are also other hopes for the expectations that are placed on accreditation. In fact, there has never been a time that there have been so many hopes and expectations placed on the accreditation process. To give you a context, at least here in the US, there are more students in higher education than ever. There's a wider range of preparation of those students. There's a wider array of programs offered. There are new ways of educating, credentials, residential, commuter, online, modular, new kinds of institutions, public, private, for-profit, embedded, freestanding, and more public money being directed towards higher education. At last count, it was over $150 billion a year from the federal government and perhaps another $100 billion a year from the 50 states. All of these bring new hopes to the accreditation process, that it will answer questions that it actually wasn't ever intended to ask. Students and families ask accreditation to tell them, can I afford this? Will I graduate? Will I get a job? Will I make enough money to live? Will I repay my loans? Policymakers ask, are students learning? Or worse yet, are they learning what we want them to learn? Are they completing their programs, and can they pay back their loans? And for the professions, what it does not do, this leads me to think about the challenges and the context of this forum. There are many challenges for the accreditors, but let me focus here on two. Challenges from and for the profession, and those from and for the larger governmental regulatory context. Let's start with challenges from and for the professions. Obviously, as you know, accreditation of professional preparation can do a lot. Quality assurance can shape the resources and curriculum of professional preparation and ensure that students are treated fairly and educated well. And quality improvement can keep us all mindful of how well we're doing and figuring out how to do things differently and better. But accreditation can't define the direction of the profession, nor can it hold it back. Let me say a bit more about those two. Accreditation of professional preparation programs can ensure that students are receiving what the profession thinks is necessary for entry into practice. But accreditation can't decide alone what those standards are. Accreditation can reflect the concurrence of the professional community and its educators, and it's those constituents and the convening and guidance of the accreditor that needs to reach that concurrence. This actually is an explicit expectation in the US from the Federal Department of Education recognition process. This is the federal accreditor of accreditors body in the US that allows federal funds to be used by students attending the institutions that are accredited. In those federal standards, it states that an accreditation agency must demonstrate that its standards, policies, procedures, and decisions are widely accepted by educators and educational institutions and by licensing bodies, practitioners, and employers in the professional fields for which the students are prepared. You can see these statements such as these in several of the accreditation standards. I borrowed here from PT. The comprehensive curriculum plan is based on information about the contemporary practice of physical therapy, standards of practice, and the current literature, document, publications, and other resources related to the profession, and so on. None of those are created by the accreditor. Another example from CCNE talks about this, the goals for determining the accreditation standards, enabling the community of interest to participate in significant ways in the review, formulation, validation, and accreditation standards and policies, and determining their reliability. You'll see something like this in each of the accreditation standards in the professions. And you'll recall, as I mentioned, let me stay back here, that an accreditor can't hold back the movement of the profession either. They need to be right in step. The relationship between the profession, its accreditors, and its educators is an ongoing conversation and challenge in which each element has a critical role. The profession's role is to reflect practice now and to envision how professional practice will evolve going forward. The educators, to translate the needed competencies now and going forward into a vibrant educational plan. And the accreditors, to reflect and hold up the concurrence across the profession and its stakeholders about what is needed in quality preparation. I know that any given individual often plays each of these roles. I've played all of them at once, and I'm sure many of you have as well, but it's important to pull them apart for the moment. They have different functions: profession, educators, and accreditors. A challenge for the professions and the educators are places where the programs chafe at having their hands tied in the accreditation standards. Those are places where the professional community and educators need to think about what level of innovation is needed and how best to include it in the accreditation system. And a challenge for the accreditors is how to convene the best conversation across all of the perspectives informally on an ongoing basis and as required by the US government formally at regular intervals. To give a very simple illustration, when I think about the relationship between a profession and its accreditor, I think of the profession as in motion. It's moving forward. It's not showing up here. There it goes. There we go. The arrow to the point to the right, as I'm simply describing that as a forward motion. You're right. In the case of healthcare professions, it's thinking about how health and healthcare practice is shifting. Out there at the tip is the really future thinking. These are the folks who imagined that we should be able to see inside the body before anybody knew that there could be technology to do so. And as you move towards the left, you find people thinking about emerging technologies and treatment tools, new patterns of comorbidity, emerging healthcare jobs and new providers. A little further to the left are the discussions about the emerging need for better promotion of health and wellness, more interprofessional collaboration, and a shift from inpatient to community care. And all the way over at the left are the discussions about things that we consider tried and true in our professional practice. So you can see from the tried and true all the way to the completely visionary. Into this panorama of the profession is the accreditor. It's somewhere in the middle. It's not quite to the front of the pack. It reflects all that is tried and true, what is agreed upon as emerging in the profession, but it doesn't yet capture the really, really new areas and issues that are all the way to the right. Those ideas may or may not become fully embraced by the profession. And important to note, what ideas and issues are out at the point, what's mid-pack, and what's tried and true varies at any moment across each profession. Indeed, one of the challenges of the accreditor, educator, and profession is figuring out exactly where that circle should be placed. The second big challenge I want to focus on today is that for and about the government and regulators. Each of the professions, whether it be architecture, drama, theology, or various healthcare professions, operates in a particular governmental and regulatory context. This is, of course, specific to each country. And you'll know well the regulatory contexts in your own countries, but let me tell you, in the US, it's pretty intense. The government regulators have, of course, far less familiarity with the specifics of the professions. Despite this limited familiarity, the government regulation has responsibility for ensuring that accreditation, or at very least the accountability, compliance, quality assurance part of accreditation, has strong integrity and can be considered a reliable guarantor of educational quality. And of course, as government and regulators, they have broader interests and concerns than do an individual profession. This context presents a critical set of challenges for accreditation, and I'm going to outline a bit of this from the US perspective, but I'll bet the participants here can provide us with examples from their countries as well. Some of what regulators expect of accreditation is very reasonable. For instance, the insistence on professional engagement in the development and regular review of the quality standards, as I mentioned before. But some of it draws from concerns that seem much more removed, especially from professional education. I mentioned earlier about the many hopes that have come to be placed on accreditors, especially in terms of finances and learning outcomes. Broadly speaking, these turn out to be concerns that are reflected in government or regulatory perspectives. Here are 3 examples. 1, protecting the student. The government is concerned to ensure that the student is a wise consumer who makes informed choices about where their educational dollar is spent. 2, ensuring that students learn, that targeted learning outcomes are achieved. Easy to say, not so easy to agree on what those learning outcomes are or how they should be measured. And 3, protecting the federal dollar investment in higher education, particularly in terms of a student being able to pay the loans that they've received. While each of these is a legitimate concern, they stem from a much broader vista than that of a single profession or even a group of professions. And the questions and metrics that are posed are more often directed to the accreditation of institutions, and particularly undergraduate institutions. Nonetheless, professional education programs, undergraduate and graduate, and their accreditors tend to get painted with the same brush. In order to function, the professions and their accreditors need to operate within this regulatory context, like it or not. I'm sure the accreditors in the room are well versed in the challenges that this creates. But for all, I want to add to my diagram. As you recall, the profession in motion, the accreditor somewhere in the middle or front of the pack, and the government or regulatory context in which both the accreditor and the profession operate. So let me turn last to opportunities. Because of the membership of this forum, multi-country, multi-profession, multi-accreditor, and common healthcare domain, this forum has some really very unique opportunities. In this, we are mindful of the important but different roles of countries and governments, of different professions, of the educators, and of the accreditors. And with those relationships in mind, there is also the opportunity to build together towards common goals, to share challenges and solutions so we can benefit from each other's experience and maybe even collaborate on new solutions. To use my diagram again, the healthcare professions are both separate and co-evolving. Their accreditors are in the middle and touch, and their larger government context, I could only fit one on this slide, wraps around them all. With the participants in this forum, the special opportunities, and I want to close by highlighting some of the critical questions that can and should be posed. The first set of questions is about the professions thinking about their futures. How can we know what ways the healthcare professions are evolving separately and together? And how are these, or could these, be reflected in professions, their practice, and their preparation? For example, professions are certainly thinking about innovative practices, emerging practitioner roles, new venues of practice, changing roles of patient, family, and community in the profession. Are there intersections across the professions out there where the point is in my diagram that we might see in common and eventually might move towards being part of the education of new professionals? A second set of questions for the educators, thinking about how to turn needed practice competencies into educational plans. How can we learn about emerging issues in practice in each profession and how common issues are or could be addressed in professional education and reflected in the accreditation standards and processes? For instance, each profession identifies the need to practice in an interprofessional context. While that's a common issue, it's addressed in different ways in different educational programs and reflected differently in accreditation. What can we learn from each other in this that might improve our education and our practice? And the third and last set of questions for the professions thinking together about educational programs and the accreditors reflecting them in quality standards and processes. How can we study the ways in which professions are learning about and addressing common issues in the education and training process? and how these are or could be reflected in the accreditation standards and processes. By addressing common issues in education and training, for example, are questions such as, how can we ensure the quality of clinical supervision? How can we provide flexibility for different ways in which programs are trying to implement a given standard? Or how can we ensure tolerance for trying out new things? And I'm sure there are many more questions that you've already considered that you're thinking about the evolution of the healthcare professions, about the educational strategies to ensure practice competencies, and about the reflection of in the accreditation standards and process. And your discussions will be even more enriched by listening for the intersections where quality preparation in each profession and in each country already touch and where they might touch going forward. It's a big list of questions to think about, and I'm delighted to have the opportunity to help launch these critical conversations. It's a terrific agenda ahead, and I'm excited to see where the discussion unfolds. Thank you.
Sit down and take questions from here.